Welcome to a discussion of compounded sterile products for the modern hospital, clinical, and home healthcare pharmacy. This presentation is provided by the Lab Safety Corporation as a guide for the use of the Valiteq, Chemoteq, and Stereotec products in achieving compliance with the USP Standard 797. USP Standard 797 establishes the minimum quality standards for the conduct of compounded sterile product programs in the United States and was officially added to the United States Pharmacopoeia as a mandatory standard of compliance on January 1, 2004. USP 797 mandates demonstrable control of all sterile product compounding processes, regardless of the location. Practitioners have expressed significant concern over both the methods and timeliness of their compliance with this new standard. Rather than simply amass data based upon assumptions about quality science, practitioners are now required to produce meaningful outcomes, leading to demonstrable improvement of the quality of their compounded sterile products, or CSPs. A recent study has revealed the possibility that medium-risk CSPs provided to the patient may have a contamination rate exceeding 5%, even when such products are compounded by experienced personnel, using standardized methods and proper facilities and equipment. Designed in accordance with USP 797, the Valiteq and Attack 2 aseptic technique validation, Chemoteq hazardous drug compounding, and Stereotec end product sterility testing systems provide a complete, outcome-producing quality improvement program for the training and validation of CSP compounding personnel and the validation of CSP processes. The integrated use of these time-proven systems allows the practitioner to achieve an overall quality number, leading to the continuous quality improvement, or CQI, mandated by USP 797. These quality systems are implemented in the following way. Step 1. Selecting the preceptor. First, the department CSP quality liaison or preceptor should be selected. This individual will normally be the IV admixture supervisor. However, in larger institutions, it may be the lead technician, as an individual experienced in CSP production. The preceptor should become familiar with and competent in the Valiteq program requirements. Upon achieving fluency in the program content, the preceptor shall be responsible for coordination and scheduling of the CQI program, including the training and validation of all personnel and the reporting of all CSP quality assurance operations to pharmacy management. Step 2. Documentation. Because documentation is the basis of any quality improvement system, as the initial step, the Valiteq Documentation Management System software, or DMS, is uploaded to the pharmacy computer. This may be the institutional mainframe or a freestanding personal desk or laptop unit. The DMS is an independent system and is not interactive with any other institutional program. The DMS is password protected, and access to the data should be limited only to the preceptor. All DMS documentation may be printed for inclusion in the candidate's hard copy file or in periodic quality reports. Step 3. The ITDR. An individual training data record, or ITDR, is prepared for each person associated with the compounding process. This record standardizes the installation of each individual operative into the CSP process and documents that person's initial training and validation, as well as periodic training and revalidation activities. Each person participating either directly or indirectly in the CSP process should have an ITDR generated and updated to assure that they understand and are capable of performing their assigned functions without compromising the integrity of the process. This should include all compounding personnel, as well as engineering, housekeeping, and any other individuals who impinge upon the CSP process in any way. The DMS also provides validation summaries, a report of all personnel due for revalidation and the dates due, along with the required assessment of aseptic technique forms, and 4 different written tests and grading keys. Equipment logs for laminar airflow equipment, refrigeration, and compounders are also printed from the DMS. Step 4. The Compounding Manual. The Valiteq 5-part compounding manual is then issued to each candidate and documented in the individual's ITDR. This manual provides standardized instruction in both theory and practices in quality assurance, engineering controls, barrier controls, the 9 core aseptic techniques, and compounding calculations. It is recommended that the preceptor familiarize the candidates with the features of the compounding manual, pointing out definitions, learning objectives, highlighting features, and the self-evaluation questions. The candidate should be instructed to complete all self-evaluation questions without making reference to the answers contained in the appendix. Step 5. The Audiovisual Program. Next, the 5-part audiovisual program is presented to all candidates. This program is available in either VHS cassette or fully authored DVD formats, which parallel the compounding manual. It is recommended that viewing sessions be attended by small groups of 4 to 10 candidates each. Each candidate should follow the presentation in the audiovisual viewing guide, which will allow the candidate to enter comments and any questions on the material covered. This will promote close group discussion for clarification of the program content and how it relates to your specific CSP operations. Upon completion of the AV program, the appropriate entry is made to the candidate's ITDR. Step 6. Assign a period of supervised practice. Following completion of the didactic portion of the Valiteq program, repetitive periods of supervised practice are carried out. During these sessions, candidates apply the principles and procedures learned to practice compounding, in some cases correcting previously learned improper techniques with the proper methods. Step 7. Administer the written test. Upon successful completion of the supervised period of practice, the written test component is administered. One of 4 possible written tests contained in the DMS should be used and graded with the appropriate test grading key. A minimum grade of 90% is required for successful completion of the written test. Results of the written test are then entered into the candidate's ITDR, along with the appropriate suspense date for annual retesting. Step 8. Administer the practical media fill exercise. The media fill exercise demonstrates the candidate's ability to accurately compound a CSP of appropriate complexity without compromising the sterility of the product. Validation of the candidate in the correct compounding techniques is carried out under the direct supervision of the preceptor, incorporating the defined process and equipment under worst-case conditions. For the initial validation, the test should be performed in triplicate when the candidate is most stressed or tired. This will normally occur at the end of the shift. Validation of USP low-risk compounding by pharmacy or non-pharmacy personnel may be carried out using the Attack 2 validation kit. Validation of USP medium-risk compounding is carried out using the RL2 kit or Valiteq bulk media. Validation of USP high-risk compounding exercises is best designed on a case-by-case basis. Information and suggestions on validating high-risk compounding operations may be obtained directly from Lab Safety Corporation by calling toll-free at 800-433-7698. Because the practical validation exercise is not a statistical test, it is essential that a competent observer be present to carefully evaluate the candidate's compounding technique while completing the comprehensive assessment of aseptic technique contained in the DMS. The following is a recommended 10-step process for demonstration of competency in USP medium-risk compounding. Direct the candidate to select the proper compounding tools for the task. Using the normal staging and setup sequence, the candidate should select and place the following materials onto the critical work surface in preparation for the media fill exercise. The Valiteq VM20R, a 20 ml vial of dry, sterile tripsoy powder. The VM30, a 30 ml vial of sterile tripsoy broth. The VM10, a 10 ml vial of sterile tripsoy broth. And the VM10A, a 10 ml ampule of sterile tripsoy broth. 2 10 ml vials or 1 20 ml vial of sterile water for injection. A filter needle. A hydrophilic dispensing pen, 9 18 or higher gauge needles, and a 150 to 250 ml empty sterile bag or evacuated bottle as the final container. Also place the following syringes onto the critical work surface: 6 10 ml, 2 20 ml, and 1 30 ml. Also, you will need an automated compounder set up with sterile water for injection, or a Y set and a bag of sterile water for injection. Step 1. If a compounder is to be used in the validation, transfer 50 ml of sterile water for injection into the final container. For operation without a compounder, use the method you would normally incorporate for transferring large volumes when compounding TPNs, usually a liter bag and a Y set. Step 2. Using the 30 ml syringe, draw up 20 ml of sterile water for injection from the staged vials and reconstitute the VM20R. Step 3. Insert a dispensing pin into the VM30. Using a 10 ml syringe, withdraw 5 ml of VM30 through the dispensing pin. Add a needle and transfer to the final container. Step 4. Using a 10 ml syringe, withdraw 5 ml of VM20R from the reconstituted vial and transfer into the final container. Step 5. Using a 20 ml syringe, withdraw 10 ml of VM10 and transfer into the final container. Step 6. Using a 10 ml syringe, make a second withdrawal of 5 ml of VM30 through the dispensing pin. Attach a needle to the syringe and transfer into the final container. Step 7. Using a 10 ml syringe, make a second withdrawal of 5 ml of VM20R and transfer it into the final container. Step 8. Carefully open the VM10A. Using a 20 ml syringe and needle, withdraw 10 ml of VM10A. Change to the filter needle before transferring into the final container. Step 9. Using a 10 ml syringe, make a third withdrawal of 5 ml of VM30 through the dispensing pin and transfer into the final container. Step 10. With a 10 ml syringe, make a third withdrawal of 5 ml of VM20R and transfer it into the final container. Label the final container with the labels provided in the RL2 kit. Prepare the VM20R and VM30 vials for storage. For maximum points awarded, the label should include the initials of the operator, the date, and in the case of reconstituted product, the diluent and final concentration. No incubator is required. Incubate these materials at room temperature of 20 to 25 degrees centigrade for 14 days. This may be carried out in a secured desk drawer or cabinet located in a stable, room temperature environment. Be certain to have some reliable means of controlling and verifying the incubation temperature, and verify the temperature at least once daily. Observe the additive vials and final containers for turbidity, sediment, or discrete colonies that indicate microbial growth at 24 hours, 72 hours, 1 week, and 2 weeks. Following each observation, make the appropriate data entry to the RL2 validation exercise sterility log provided in the RL2 kit package insert. Remember, the initial validation process for each operative should be carried out in triplicate. Recurrent revalidations may be carried out as a single exercise. The initial and recurrent exercises must duplicate the most complex compounding process that the operative is likely to encounter during normal operations. Validating a simple USP medium risk process, such as 1 or 2 additives to a large volume parenteral, does not validate more complex medium risk processes, such as preparation of TPNs. The complexity of the validation exercise must match the complexity of the actual compounding process in order to meet the requirements of USP 797. There are many ways to increase the complexity of the Valiteq validation exercise to simulate the most complex processes encountered by your compounding staff. The basic process we have presented yields a bag or bottle containing 100 ml of growth medium. The candidate may be directed to perform additional manipulative steps, such as drawing up syringes from the bag, attaching an administration set, making a bulk transfer using a Y set, or attaching a repeating syringe and dispensing multiple aliquots into empty sterile vials. Numerous variations are possible and should be incorporated into your technique challenge and process validation exercises in order to simulate all of the compounding tasks normally encountered in your individual setting. For a more exacting challenge of the operative's skill, a compound strength may be assigned to each of the additive containers to verify the candidate's ability to calculate the proper volumes for all additives. For example, the compound strength of each of the Valiteq additives may be represented as milligrams or milliequivalents per ml and indicated on the label. The validation exercise may then be initiated directly from the label or the physician's order. Completing the data entry. At the completion of the incubation period, enter the date of the media fill exercise into the candidate's ITDR, along with its pass or fail outcome, and the due dates for revalidation. The DMS database will display the due dates for recurrent training, testing, and revalidations for all candidates, and provide them in the form of reports and summaries, which may be referenced either as electronic documents or printed out for inclusion in your periodic quality assurance reports. The Attack 2 Kit. USP Standard 797 mandates proper training and validation of the technique of all persons compounding CSPs prior to their engaging in actual compounding activities. Many non-pharmacy personnel, such as nurses, emergency medical technicians, and medication technicians, are called upon to compound USP low-risk CSPs. The Attack 2 Kit is provided for the testing and validation of the compounding technique of these personnel and pharmacy operatives engaged only in USP low-risk compounding. Following an adequate period of training and practice, the aseptic technique of the non-pharmacy candidate should be challenged under conditions which are representative of normal non-pharmacy compounding operations. Engineering and barrier controls should be employed only to the extent that such controls are used by the candidate during his or her actual compounding operations. Step 1. Review the audiovisual program. Using the fully authored DVD program format, an abbreviated AV program presentation is recommended for viewing by non-pharmacy compounding personnel. This program familiarizes the non-pharmacy candidate with the essentials of quality assurance, barrier controls, aseptic manipulations, and calculations to reinforce the compounding skills of these personnel. Step 2. Administer the written test. Following a review of the AV program and successful completion of an adequate period of supervised practice, the Attack 2 written test component is administered. 3 identical written tests are contained in the package insert. The correct answers are available to authorized personnel directly from Lab Safety by fax or email request. This is done to secure the answers and prevent their dissemination by unauthorized personnel. A minimum grade of 90% is required for successful completion of the written test. Results of the test should then be entered in the candidate's ITDR, along with the appropriate suspense date for annual retesting. Step 3. Administer the practical media fill exercise. As in the RL2 USP Medium Risk Challenge, this practical test demonstrates the candidate's ability to accurately compound a USP low-risk CSP without compromising the sterility of the product. Validation of the candidate in the correct compounding techniques is carried out under the direct supervision of the pharmacy preceptor under definable worst-case conditions. These conditions should be defined and entered into the information sheet included in the Attack 2 package insert. As in pharmacy, the initial validation should be performed in triplicate when the candidate is most tired or stressed. This will normally occur at the end of the shift. The following is a recommended 6-step process for demonstration of competency in USP low-risk compounding. First, have the candidate read the instruction sheet enclosed in the package insert. Direct the candidate to select the proper compounding tools for the task. Using the normal staging and setup sequence, the candidate should select and place the following materials onto the critical work surface in preparation for the media fill exercise: the VM30T, the VM20R, the VM10DA, one 50 ml bag or bottle of normal saline for injection, the following syringes: 5 ml, 2 10 ml, and 1 30 ml, a filter needle, 8 18 or higher gauge needles, and 10 alcohol swabs. As in the USP Medium Risk Challenge, for a more exacting challenge of the operative skill, a compound strength may be assigned to each of the additive containers to verify the candidate's ability to calculate the proper volumes for all additives. Step 1. Fill out the VM30T vial label, the 3 syringe labels, and the final container label. Affix the label to the final container. Step 2. Withdraw 30 ml of normal saline from the final container and reconstitute the VM20R with 20 ml of the solution. Discard the remainder. Step 3. Withdraw 2 each 5 ml doses, 1 each 10 ml dose, from the reconstituted VM20R and add to the final container. Note that the final container will now contain 40 ml of diluted tripsoy broth and the VM20R will be empty. Step 4. Prepare 3 each 5 ml syringes from the final container produced in Step 3 and affix the prepared syringe labels. Step 5. Open the VM10DA ampule and withdraw 10 ml. Change to the filter needle and add to the VM30T. Collect the final container, along with the 3 syringes and the VM30T test vial, and incubate in the manner of the USP Medium Risk Challenge. On occasion, the overall contamination rate of CSPs prepared by non-pharmacy personnel may exceed acceptable levels. The Attack 2 information sheet contained in the package insert is designed to assure that information concerning the circumstances of each validation is available to the Director of Pharmacy, should the Director need to institute non-pharmacy compounding procedural changes. Properly completed, the information sheet is designed to provide specific information on the environmental, work area preparation, hand and glove preparation, critical site disinfection, ampule handling, and general manipulative technique factors which are necessary to support the recommended corrective actions in discussions with nursing, emergency medicine, and other departments. Chemotech hazardous drug compounding. Compounding hazardous drugs poses an exceptional challenge. Product sterility and purity must be maintained, while any release of the drug is prevented. As the most comprehensive hazardous compounding skills indicator, the Chemotech Hazardous Drug Compounding Validation System provides a simultaneous validation of both the aseptic and containment compounding techniques of the candidate. As a course prerequisite, the candidate must complete the Valiteq Aseptic Technique Validation Program and successfully perform a media fill simulation of medium or low-risk compounding using the RL2 or Attack 2 kit. Step 1. Issue the Compounding of Hazardous Drugs Manual. This full-color manual provides essential additional information on containment technique as well as a review of pertinent information from the Valiteq Aseptic Compounding course. The manual is organized according to learning objectives and includes self-evaluations to provide the candidate with the necessary additional information. Step 2. Perform the hazardous compounding skills validation. To assure that the candidate has mastered the skills necessary to maintain both the sterility and containment of the hazardous drug, the Chemotech Hazardous Compounding Skills Validation should be performed. The Chemotech Hazardous Compounding Validation Kit contains sufficient growth media for 2 complete validation exercises. For each exercise, the candidate will require the following materials from the kit: 2 each VM50 vials, 2 each VM25 vials, 2 each VM10AC ampules, all Chemotech process labels, and 7 each tracer detection swabs. Each exercise will require the following additional supplies: 1 150 to 250 ml empty evacuated container, 1 100 ml bag of normal saline, 30 ml of sterile water for injection, an administration tubing set, 2 each hydrophobic dispensing pins, 10 19-gauge needles, 2 filter needles, 2 each empty sterile vials of greater than 10 ml capacity, the following syringes: 8 20 ml, 2 30 ml, and 3 60 ml, 6 syringe caps, 6 vial seals, a sterile gauze for ampule opening, a work surface hazardous waste container, and an outside hazardous waste container. The preceptor should become thoroughly familiar with both the examiner activities and the participant activities sections of the Chemotech product insert. The preceptor and candidate should then carefully review the participant activities and the Chemotech Practical Skills Evaluation form. Both should be completely familiar with the requirements prior to commencing the exercise. Using the standardized hazardous drug compounding process and normal engineering and barrier controls, the exercise should be conducted as follows. Step 1. With a 60 ml syringe, transfer 50 ml from the bag of normal saline to the empty evacuated container. Step 2. Attach an administration set to the bag as the final container. Prime the set and secure to prevent leakage. Step 3. Using a dispensing pin and 60 ml syringe, remove 50 ml of medium from one of the VM50 vials and transfer it to the evacuated container. Step 4. Without using a dispensing pin, remove 50 ml of medium from the second VM50 vial and transfer into the final container. Step 5. Transfer 10 ml from one of the VM10 AC ampules into the evacuated container. Make any final adjustments in an empty vial. Step 6. Transfer 10 ml from the other VM10 AC ampule into the evacuated container. Make any final adjustments in an empty vial. Step 7. Without using a dispensing pin, add 25 ml of sterile water for injection to one of the VM25 vials. Step 8. Using a dispensing pin, add 25 ml of sterile water for injection to the other VM25 vial. Steps 9 through 11. Without using a dispensing pin, prepare 3 each 10 ml syringes from the VM25 vial diluted in Step 7. Steps 12 through 14. Using a dispensing pin, prepare 3 each 10 ml syringes from the VM25 vial diluted in Step 8. Step 15. Properly prepare and label the vials diluted in Steps 7 and 8, as well as all final containers and syringes prepared. While the candidate completes the exercise, the preceptor should observe and score the skills and practices on the Chemoteq Practical Skills Evaluation form. The candidate should employ all personal hygiene and barrier controls, engineering controls, staging, aseptic manipulations, cleanup, waste disposal, logging, and other procedures in accordance with policies, and should be graded for compliance. A minimum passing grade of 90% is required for successful completion of the practical exercise. Upon completion of the compounding activities, when the candidate has removed all products from the hood for inspection, but before he or she has completed any cleaning or additional degowning, perform the tracer detection swabbing exercise presented on page 6 of the Chemoteq package insert by thoroughly swabbing a 14-inch by 14-inch square section of the following areas for recovery of any red or pink residue. Area 1. The work surface of the BSC, following proper disposal of chemomat if used. Area 2. The outer surfaces of the products. The septa and injection port areas are the most commonly contaminated sites. Area 3. The candidate's gown sleeves and gloves, especially the fingertips. If proper procedure has been followed, the candidate should have properly removed and disposed of the outermost pair of gloves prior to removing hands from the hood, and the inner pair should be clean. Area 4. The entire front grille and lower threshold or lip of the BSC. Area 5. The floor in front of and under the hood. Area 6. The countertop or work surface where the product was placed upon removal from the hood. Area 7. The outside of the chemo waste container. To view the residue recovery results, lay the swabs against a pure white background, such as the Chemoteq container base, to maximize color contrast. Any red or pink color detected in location 1 demonstrates inadequate progressive in-process sanitation of the BSC. This increases the risk of personnel exposure and the risk that subsequent product may be compromised. Color detected on swabs from locations 2 through 7 demonstrates that the candidate's technique has failed to contain the product within the BSC. Additional training and practice are indicated. No color recovery on any swab constitutes a negative test, or pass. Upon completion of the exercise, be certain the candidate's name, the date, and all other required information appears on the labels provided. and that the labels are securely attached to the appropriate containers. Incubate the bag, the bottle, the 2 diluted vials, and all 6 syringes in the manner described in Demonstration of Manipulated Product Sterility on page 3 of the Chemotech product insert. Using the Practical Skills Evaluation, the Tracer Detection Swabbing Exercise, and the Demonstration of Manipulated Product Sterility sections of the package insert, evaluate the performance of the candidate and determine any required corrective actions. Complete all entries for the Practical Skills Evaluation on the product insert and make the data entries to the candidate's ITDR. Training and Validation of Administration Technique. Following the incubation period and confirmation of the sterility of the Valiteq and Chemotech compounded products, the bags, bottles, and syringes of sterile medium may be used to challenge and validate the administrative technique and skills of nursing personnel. To accomplish this, the released sterile products should be delivered to the nurse with instructions to simulate the administration of the product to the patient. The nurse should then stage and simulate administration of the Chemotech product by staging, starting, and collecting the compound into an empty sterile bag, staged on a pure white pad or towel in the normal location of the patient's catheter or port. The preceptor should observe the exercise for proper administration and disposal technique, as well as any release of drug, by swabbing the ports and line in the same manner as the compounding test. The final bag should be labeled with the nurse's name and date of the test, and be incubated in the same manner as the original test materials. Steritech sterility testing. Sterility testing of compounded sterile end products may be carried out using the Steritech end product sterility testing system. This pharmacy-friendly assay incorporates only a needle and syringe, the Steritech vial, and the end product final container, eliminating the need for extraneous filters, tubing, and pumps, which require specialized handling and complete dexterity. In addition to incorporating pharmacy-familiar tools and techniques, the Steritech assay rules out the possibility of a false positive result by assuring that both compounding and testing of the end product is carried out by the same operative. Because there is no intervention by another person into the process, the results of the assay may be attributable to that individual within the continuum of his or her aseptic technique. The Steritech assay is a destructive test, meaning that the product is unusable by the patient following testing. The Steritech test subject will normally be a CSP remaining on hand following an order change, or an unused CSP returned from the floor or patient care area and tested outside the aseptic core, within 12 hours of compounding. Test subject selection should be carried out randomly on a daily basis. Each compounding operative is issued a vial of Steritech labeled for their individual use, with the instructions that it be handled and stored carefully in the manner of a multi-dose vial. The test subject is then given to the compounding operative with the request that it be sterility tested. The operative should then apply the test label to the product and return it to the critical work surface in preparation for the test. Uncomplicated testing of the CSP is carried out using standardized compounding procedures by aseptically inoculating it with 5 mL of Steritech per 100 mL of CSP. For example, a 500 mL CSP would be inoculated with 25 mL of Steritech. The test subject should then be mixed thoroughly and transferred to a secure area for incubation at room temperature of 20 to 25 degrees centigrade for 2 weeks. Following the assay, the test subject is checked for turbidity, sediment, or discrete colonies which indicate microbial growth at 24 hours, 72 hours, 1 week, and 2 weeks, and the appropriate entry is made to the Steritech sterility report contained in the Steritech package insert. In this manner, accurate sterility testing of CSPs may be carried out quickly and simply by pharmacy operatives without the need for extraneous procedures or equipment. Steriquat sterility monitoring. The sterility monitoring of CSPs may be carried out simply and easily using the SteriQuat end product sterility monitoring system. As a pharmacy-friendly assay, SteriQuat is normally used for monitoring the sterility of CSPs, such as injections, TPNs, or small volume parenterals. SteriQuat is a non-destructive test, meaning that the CSP test subject or batch remains usable by the patient following testing. As with Valiteq, the SteriQuat assay is performed by the operative who compounded the product, with no intervention into its sterility by other persons. An aseptic sample of 2 to 12 mL of the test subject contents is inoculated into the SteriQuat vial, covered with a sterile tamper seal, and placed into room temperature incubation at 20 to 25 degrees centigrade for a period of 2 weeks. The test subject should then be checked for turbidity, sediment, or discrete colonies which indicate microbial growth at 24 hours, 72 hours, 1 week, and 2 weeks, and the appropriate entry should be made to the SteriQuat sterility report contained in the SteriQuat package insert. In this manner, the non-destructive sterility monitoring of CSPs may be carried out quickly and simply, without extraneous procedures or equipment. Bulk validation media. Each of the Valiteq validation media is available in packages of 12 each, facilitating the most economical approach to testing large numbers of compounding personnel. The acquisition of bulk media will also facilitate more complex and challenging validation exercises, assuring that all USP medium-risk compounding processes may be easily validated using all common pharmacy packaging forms. ACPE continuing education credit is available to the hospital, clinical, and home health care pharmacy through a co-sponsorship program with Lab Safety Corporation. Directors of pharmacy interested in providing continuing education credit for their Valiteq and Chemoteq training and validation programs should contact the Continuing Education Administrator for Lab Safety Corporation at 800-433-7698. It is important that this be accomplished prior to disseminating or viewing any of the training materials, due to the pre- and post-course evaluations which will need to be completed. 0.6 CEUs, or 6 contact hours, will be awarded for successful completion of the Valiteq Aseptic Technique Validation Program. 0.4 CEUs, or 4 contact hours, will be awarded for successful completion of the Chemoteq Containment Aseptic Technique Compounding Validation Program.